Good morning, friends. Uh, I hope you all are enjoying good weather, Sunday, relaxing at home, and uh, that's news which I gave you. You got the confirmation also, I think, official confirmation in public domain now. So you all must be delighted. आप सबको अच्छा लग रहा होगा क्योंकि आपको मैंने जो भी इंफॉर्मेशन दिया था वो पब्लिक डोमेन में आपकी उसकी पुष्टि हो चुकी है, पर वो पुष्टि आधी हुई है अभी तक। ये मैं आपको चेक दे देता हूँ कि टिल नाउ ओनली हाफ द इंफॉर्मेशन इज वेरीफाइड एंड ऑन दैट हाफ इंफॉर्मेशन you are so much excited. Why half information I am saying? Because still there are because for the new medical colleges no time left to open the seat, but for old medical colleges certain queries are remaining, so they are waiting, still they are waiting to get the answer from the government setup, government of the state. And once they get the answer from the government of the state within the time, then they may add up those seats into the counseling. क्योंकि गवर्नमेंट अगर जवाब टाइम पे देगी तभी वो जोड़ पाएंगे। हालांकि पुराने कॉलेजों में अभी भी काफ़ी एक सिग्निफिकेंट नंबर जो है वो जोड़ा जा चुका है। तो आपका एनएमसी बिल की सीट्स इंक्रीज हो रही हैं, आपकी नए मेडिकल कॉलेजेस की सीट इंक्रीज हो रही हैं पोस्ट ग्रेजुएट्स के लिए, और उसके अलावा आपकी पुराने कॉलेजेस के अंदर भी सीट इंक्रीज हो रही हैं। तो इट्स ए ट्रिपल बोनस फॉर ऑल ऑफ यू फॉर दिस ईयर 2022 एस्पायरेंट्स। पहले मैं आपके पोस्ट ग्रेजुएट से पहले मैं आपको एक अंडर ग्रेजुएट्स के बारे में भी बात करना चाहूँगा। अंडर ग्रेजुएट्स में भी मैंने जब बच्चों का पेपर था उसके इमीडिएटली बाद में पेपर चेक किया, देन मुझे पेपर देखते ही लगा कि हाँ पेपर उसी लाइन पे है, और जो मैंने बताए थे उसी क्वेश्चंस उसी लाइन पे थे, उसी सोर्स पे थे। तो कट ऑफ जो थी वो मैंने 582 बताया था, और मैंने एक चेक ये भी दिया था कि ये डाउनवर्ड ट्रेंड्स में है, अपवर्ड ट्रेंड में नहीं है। तो डाउनवर्ड ट्रेंड्स में और भी नीचे जा सकती है। तो नीट यूजी के अंदर जो कट ऑफ थी, और ये पीजी में भी एप्लीकेबल होता है, उसके बारे में बात करूंगा बाद में। नीट यूजी में पिछले साल 2021 के अंदर लगभग 4000 सीटें इंक्रीज हुई थी गवर्नमेंट सेक्टर में। 3890 3900 करीब सीटें गवर्नमेंट कॉलेजेस में इंक्रीज हुई थी। उसकी वजह से जो कट ऑफ थी, सिमिलर रैंक होने के बावजूद 2020 और 2021 में सेम मार्क्स सिमिलर रेंज, सिमिलर मार्क्स सिमिलर रैंक इन 2 years, कट ऑफ जो थी वो 595 तक नीचे आ गई थी। और इस बार जो सीट्स इंक्रीमेंट है वो पिछले साल से लगभग 1.5 गुना ज्यादा है, मोर देन 1.5 times इन नीट यूजी। सो डेफिनेटली दो डिक्रीज होंगी वो सीट्स ज्यादा होंगी। और दूसरा बड़ा फैक्टर जो नीट यूजी में काम करेगा वो ये होगा कि राजस्थान के अंदर 4 नए कॉलेजेस खुल रहे हैं। तो राजस्थान में जिस साल नए कॉलेजेस की संख्या ज्यादा होती है उस साल नीट यूजी की जो ऑल इंडिया कट ऑफ है वो ज्यादा नीचे जाती है। उसका रीजन ये है कि राजस्थान के लड़कों का सिलेक्शन अच्छे खासे अमाउंट में होता है। इस बार भी जैसे पिछले बार हुआ था कि ऑल इंडिया कोटा से हर तीसरा बच्चा राजस्थानी था। 34% राजस्थान स्टूडेंट्स सेलेक्टेड इन ऑल इंडिया कोटा। इस बार ये नंबर बढ़ेगा, ये 40% क्रॉस करेगा। ऑल इंडिया कोटा की 40% सीट्स जो होंगी वो राजस्थान अकेला लेके जाएगा। और राजस्थान में जो कट ऑफ लास्ट ईयर थी, 4 नए मेडिकल कॉलेज खुलने के बावजूद भी आपकी कट ऑफ फर्स्ट राउंड के अंदर ज्यादा फर्क नहीं पड़ेगा। 641 थी आपकी कट ऑफ, वो 641, 638, 636 ही आ पाएगी, उससे नीचे नहीं आएगी। और क्योंकि राजस्थान के बच्चों का स्कोर जो है दूसरे स्टेट्स के बच्चों के कंपैरेटिवली काफी ज्यादा है, तो ये एक यूजी का एक क्विक अपडेट था। तो आप अपने जो भी जूनियर बच्चे हों, घर में हों, आपके पड़ोस में हों, उनको ये इन्फॉर्मेशन पास ऑन कर सकते हैं कि वो रिलैक्स रहें। 582 बोला है, 560 तक इजीली, 560 550 तक आप रिलैक्स रहें। और एनएमसी बिल आ गया तो आपका उसके बाद में क्या कट ऑफ होगा उसका कोई भी व्यक्ति प्रेडिक्ट नहीं कर पाएगा कि वो कहाँ तक जाएगी। पर 550 तक वाला रिलैक्स होके रहे, वो अभी इतना हरी नहीं करे कि उसको कोचिंग ज्वाइन करना पड़ेगा दोबारा। नाउ कम टू दी पोस्ट ग्रेजुएट थिंग। I gave 2 days before in the evening, in the night time, I gave the update, uh, which you got the confirmation yesterday in public domain. और जो क्वेरी है कि क्वेरी आई थी, और पोस्ट दैट माई लाइव आई रिसीव्ड more than 1300 emails, and I replied each and every email personally to all of you. More than 1300 mail. Before the start of this live, I replied each and every mail to all who sent me the mail. Question was asked in one mail. One question was asked by Dr. Parmar also, that what is phase 1 and what is phase 2. So once the NMC bill passed in the parliament in 2018, and government gave permission and the to start the centrally sponsored medical colleges. मेडिकल कॉलेजेस की दो कैटेगरीज अब हो चुकी हैं गवर्नमेंट में भी, स्टेट एंड सेंटर। जो स्टेट के मेडिकल कॉलेजेस हैं, दोज कॉलेजेस विच आर इन स्टेट, विच वर ओल्ड मेडिकल कॉलेजेस, in those colleges state government have to give 40% contribution, 60% contribution is giving by the center. After passing of the NMC bill, the centrally sponsored medical colleges start opening in the country. और जो सेंट्रली स्पॉन्सर्ड ओपन कॉलेजेस हैं उसमें 90% कॉन्ट्रीब्यूशन सेंटर का होता है और 10% स्टेट का होता है। सो फेज 1 2018, फेज 2 2019, 2020 भी फेज 2 में, क्योंकि कुछ कॉलेजेस का चक्कर था, इसलिए फेज 2 एक्सटेंड करके वो 2020 तक भी गया है। तो मैं अभी 2020 के कंफर्मेशन एक कॉलेज की मेरे पास है, अदरवाइज मैं आपको कॉलेज की लिस्ट बताता हूं पहले गोइंग फर्दर कि कौन कौन से इंस्टीट्यूट स्टेट वाइज हैं जिसमें आपके पोस्ट ग्रेजुएट आएगा। देन आई विल टेक द नेक्स्ट अपडेट, नेक्स्ट थिंग इन माय लाइफ। सो अरुणाचल प्रदेश, नाहरलागन, दादरा नगर हवेली, सिलवासा, विनोबा भावे मेडिकल कॉलेज में डीएनबी हुआ करती थी। दैट डीएनबी नाउ कन्वर्टेड टू द पोस्ट ग्रेजुएट थिंग। हमीरपुर में आपकी क्लासेज स्टार्ट हो चुकी थी, दैट वाज गवर्न। बट इन जम्मू कश्मीर, अनंतनाग, बारामूला, कठुआ, राजौरी, झारखंड के अंदर जो कॉलेज थे दुमका, हजारीबाग, पलामू, उनमें एमबीबीएस ओपनिंग में भी काफी प्रॉब्लम आई थी, बट दे गेट दी पोस्ट ग्रेजुएट सीट्स। पलामू, दुमका, हजारीबाग। मध्य प्रदेश, छिंदवाड़ा, दतिया, जहां पे आपकी सीट्स इंक्रीज हुई हैं, फेज 1 फेज 2 की बात कर रहा हूं मैं, खंडवा, रतलाम, शहडोल, शिवपुरी, देन इन महाराष्ट्र बारामती, जलगांव, मिजोरम जोराम मेडिकल कॉलेज, इन उड़ीसा बलांगीर, बालासोर, and in old medical colleges also. In Rajasthan, Badmer, Bharatpur, Bhilwara, Churu, Dungarpur, Pali. In Tamil Nadu, Karur. In Telangana, Nalgonda, Siddipet, Suryapet. In UP, Badayu, then Faizabad, Firozabad, बस्ती, शाहजहांपुर, बहराइच, in West Bengal, Cooch Behar, Diamond Harbour, then Raiganj, and Rampur Fulhart. So these are the colleges where you will get in new seats. These are centrally sponsored seats, and the number which I gave you has been vindicated, or you can confirm. You confirmed yesterday in public domain. मैंने आपको वो पहले एडवांस में इंफॉर्मेशन जो थी वो उसका दिया हुआ था. इन सीट्स के अलावा जो आपके पुराने मेडिकल कॉलेजेस हैं उनमें भी स्टेट्स के, जैसे अगर हम गुजरात की बात करें, बीजेएमसी, बड़ौदा, भावनगर, जामनगर, राजस्थान, जयपुर, अजमेर, बीकानेर. जयपुर में नहीं हो रही है सीट इंक्रीमेंट क्योंकि वो पिछले साल हो चुकी हैं, पर बीकानेर, उदयपुर, अजमेर, जोधपुर, कोटा, झालावाड़, हरियाणा पीजीआईएमएस रोहतक, then this Kalpana Chawla, then in Punjab, Amritsar, Patiala, Faridkot, Delhi state medical colleges, seat incremented few, but there are there in old medical college. I'm talking in Uttar Pradesh also, KGMC, SGPGI, then Gorakhpur, Allahabad, Kanpur, Jhansi, Meerut, Saharanpur. In Madhya Pradesh, Indore, Bhopal, Rewa, Jabalpur, Raipur, Chhattisgarh, Jamshedpur, Ranchi, Jharkhand, Cuttack Medical College, Odisha, Puri have asked for the increment in the college, but that has been denied. West Bengal also, many colleges list are there. So in old colleges also, the seats, they are getting the approvals now, and the seats increase there also. So वहां पे भी आप increase हुई हैं. जो सेंट्रली स्पॉन्सर्ड मेडिकल कॉलेजेस खुल रहे हैं उनमें इंक्रीज हुई हैं फेज 1 फेज 2 की. आपकी 50% प्राइवेट कोटा की सीट, जो प्राइवेट मेडिकल कॉलेजेस की सीट्स हैं, वो भी आई हैं. सो यू आर नाउ गेटिंग ट्रिपल बोनस. फेज 1 फेज 2 सेंट्रली स्पॉन्सर्ड मेडिकल कॉलेजेस इन द स्टेट्स, ओल्ड मेडिकल कॉलेजेस इन द स्टेट्स, एंड द डीम्ड एंड प्राइवेट मेडिकल कॉलेजेस 50% सीट at par with the government quota fees. So this increment is very significant, and that's why I told in my 2 days before, when I was live on the night, that I have to revise my cutoff. But bear with me, I will take 1 week time, because today I have to work on the PG 2023 aspirants next presentation and the next question set, so that I can post it tomorrow evening. And I have replied each and every mail, but now in this week you may get the delayed response because of some certain issues or some certain work related issues with me. So Dipankar, almost all the medical colleges get the increment. In Bihar also, yes, PMCH increment already happened, but the in Muzaffarpur and Darbhanga and Bhagalpur medical colleges got the increment. So so they will get the increment there over. And so this is the important feedback and list of the colleges which I shared, that where you will get the postgraduate seat increment. And now comes to the another point which is very important, relevant, and I got few mails regarding this apprehensions, that whether we should join the new medical colleges for the postgraduate or not, because we won't have any seniors to guide us. This is a very good and relevant questions, but uh, I'm telling you the my experience, because I didn't have any options and I have to join the newly opened medical college. But after joining there, when we start our clinical practices, because our time there was only 3 MBBS, first, second, and third. So start in second MBBS, we directly get exposure to the patients, and we had direct contact with our professors and assistant professor and associate professors. So they used to taught us all the cases. They explained everything to us, and we got first hand experience and hands on training. So that was very useful for us, and that's why my personally in if you ask about the OBG, my first delivery in my labor room, independent delivery, I did it independently, the breech, normal breech delivery. My first independent delivery in intern is breech, and my first independent delivery at PSC was an obstructed semi obstructed labor, which I managed to deliver that patient normally. So that was the advantage, because we got the experience from the uh, professors. I used to manage uh, many cases of severe cases in the cardiac cases, respiratory cases, even neuro cases at PSC, because we learned a lot in medicine from the professors. So this is an advantage. This is an advantage, that if you go in the new, if you get an opportunity in the new medical college, first batch of the postgraduate, then you have direct contact with your professors. Whatever problem is there, who to whom you will ask? You will ask to the professor. You will ask to the assistant professor. Okay, sir, please help us. Sir, this is the issue. So they will teach you, and because they have the more experience, so you will get a more experienced answer. In old medical colleges, the new postgraduate student used to ask the queries to the seniors, and their experience is okay, this their experience is rich, I am not denying. But if you compare the experience of a postgraduate student and a faculty, definitely faculty have the good experience. That's why they are faculty there, and they are the senior one. So they will teach you more explicitly and more beneficially, and they will tell you the more practical way to handle the patients. So don't worry if you get the seat in the new medical colleges for the post graduation. So please do not send the queries again, because I will check the queries and I'll reply, Rajiv, all the queries. Don't worry. Um so this is need not to worry. One query which is one query which amazed me, or which amused me, I rather say amused me, that some of asking about that we have this much of our flexibility, and we can go to this range. So whether we will get this there or not. So definitely, if you have a flexibility and if you are able to go to that range, then definitely you will get it at your rank. No issue in that one. So there is nothing. One query which I received over the mail was whether we should go for the counselor's help or not. It is your call. You can go, because they are doing, they are professionals, they are doing over the years. So they and they can fill the they can fill the counseling on ease for you. But as I informed you that on the day one of the counseling in the evening, I'll do a demonstration that how to fill the counseling with the ease. So it's up to you. You can go. You can take the help of the professional counselors. No issue in that one, because definitely if you get the help, it will be better for you. I'm not saying that you should not go. It's up to you. It's your call. Now, come to the queries. Yes, NMC, as you have noticed in the reply in the Lok Sabha also, two different questions in Lok Sabha and in Rajya Sabha. The government already start implementation of the National Medical Commission Bill from the 2018. Due to the COVID, delayed was there, but now things are moving towards a direction. That's why first time college, before completing their first batch, getting postgraduate seats, and now private medical colleges 50% seats to become at the fee with the government. Why? Because it is envisaged in the NMC bill that government is committed to provide a quality medical education at affordable cost to the citizen of the country. So this is preamble of the NMC bill, and to fulfill that preamble, this is the way, this is the pathway, and this pathway will open in 2022 counseling. Yes, yes, your son may get at desired place, but you have to go for the round 2 or mop up. Now come to the notification of 2023. As I informed, during the counseling, you will get the notification, or just before the, along with the notification for the counseling, in day or two of that notification, you will get the information notification for the 2023 also. Another query which is common and asked to me, that whether it will, our counseling will start on the 1st of September or not, because the one newspaper in Rajasthan published the date 1st September. But let me tell you, that is speculation. There is no confirmation of the date, official confirmation, even on the files, no movement of the date in case of counseling. What is the status is, they are waiting to resolve the EWS case. As I mentioned, that government is still adamant not to change the EWS criteria, and Supreme Court wants to change the EWS criteria so that they can continue the EWS reservation. But government is adamant. So let's see what happens this week in the Supreme Court. What comes out in the Supreme Court from the kitty of the government. That I'll ask in advance, and I'll see what will happen. So once the case settled, now take the hypothetical situation. Case settled on 27th itself. So 7th, after 7th August, the seats will be finalized, and by the 15th August, you will get the notification. And this year, no seats will be added between the counseling in round 2 or mop up. No seats will be added in round 2 or mop up. Whatever seats they announce in round 1 will be carry forwards. Vacant seats will be carry forward in round 2 and round mop up. And if any remains after mop up, then the stray vacancy round. So this is the first hypothetical situation. Now comes to the second one. Court doesn't have the time on the 27th, and they give the another date of the hearing, and that falls in the first week of August, or they continue the hearing to the first week of August. Then your notification will fall after 20th of August. So as of now, as far as I know, government may say in the court that we are waiting for the reply from the states on some deficiency of the seats, that's we may go add in the counseling. So please give us the time to this period, so that after that we will do the counseling, and this one, so after that we will start the counseling. In that scenario, court may also get relaxed, and they may extend the hearing. So this is the scenario. So that's the about the 1st September news. So that's not a confirmative news. uh, that's all speculations which are floating on the YouTube, and based on that they are saying 1st of September, but that's not sure. It may be it may extend to the 15th September. Who knows? The court matter, how long the court matter will go. Last year the court matter started in July and extended till October. So nobody knows so how long the court matter will extend, and the counseling will commence. So that's depend upon the EWS scenario. PGIM are going to open. PGIMER approval is given from the central government end, and now budgetary provision and everything is going on. So depend upon that. Uh, for the cutoff predictions, please check my previous videos. Yes, Dr. Sahu, for the phase 1 and phase 2 will be available for this year. Phase 1 and phase 2 will be available for this year only. And in which institutes? I just in the beginning I mentioned the list of the student institutes also, where you will get the seats, new seats. Yes, DNB seat is possible at this rank. In Odisha, I have, though I have replied over the mail, but still there are 30, more than 30, nearly 40 seats are pending. Queries are pending for the nearly 40 seats. And in those 40 seats, mainly clinical seats are there. So, because paraclinical and preclinicals, hardly any queries. But for the clinical subjects, there are queries. So, for queries are pending for those 40 seats. So, let's see what inspire after 7th August. If the candidate change status from the general to NRI, they also eligible to apply for DNB and 15% All India quota government seat. Yes, they can, because the general seats are open for all. If a NRI candidate secure a rank of 8,000 and get admission in the general medicine in any college, then he will not occupy the NRI quota seat. He will occupy the government quota seat. NRI is a quota. Similarly, other backward class is a quota. Economic weaker section is a quota. Scheduled caste is a quota. Scheduled tribe is a quota. So these are the quotas in which those category students are eligible to take admission on those quota seats only. But they can take admission on the general seats also if they stand at that merit. So I think you got the reply of your query. Ritesh, I have replied for the 1st September. The notification information I have given. So, Pragya, this is a very good query that in new medical colleges they have the so much of facilities. So that depends, and for example, if I see the colleges in northern states, particularly in UP and Rajasthan, or in Madhya Pradesh also, these colleges are located in the city. Now some colleges start opening on the periphery of the city, but once the medical college is started, the influx of the patients are more, and due to the due to a brand name of a medical college, the influx of the patients increased automatically. That's why they have the facilities. Thirdly, because when you open a medical college, there are certain points which must be available so that they can give the permission to open the colleges. So there is a checklist. So in that checklist, everything is if fulfilled, then they give the permission to open the medical college. Similarly, there is a checklist for the postgraduates also, post graduation also. So if everything is ticked on that checklist, then only get the permission. So no need to worry, you will get the good surgical experience also in the new medical colleges, and that's an advantage if you think from the other perspective, that you will have a direct touch with your professors. Dr. Jha, I replied this one. Yes, it is going to reply. Uh, Dr. Gupta, at this rank, uh, if you are from Delhi, then it's difficult to get the good seats in MMC or other thing. But um, in other states, you can get the Premier Institute by round two. By round two, you get the Premier Institute General Surgery at this rank. Let's check from the beginning. Good morning. Good morning. Uh, MD anesthesia. Dr. Sivangi, I think you sent me the mail and I have replied over the mail. Must be you must be on the A's for this rank. Dr. Sarkar, yesterday you got notice which I informed day before yesterday. So need not to worry. I informed you in 1 day advance. And that's the document from the Lok Sabha. Yes, Dr. Pandey, I replied over the mail. So why you get anxious? Yes. Yes, seat mentioned increased this session 2022. Only one college is there for Tamil Nadu, and there are some deficiencies. That's why the you are not getting, because in phase one, phase two, Karnataka get the maximum colleges last year. So you will get the postgraduate seats in 2023 or 24 in those colleges. But in old medical colleges, seat increment is there. In Chennai, all three or four medical colleges are there. Seat increment is there. In Madurai, in Coimbatore, in Vellore. In Vellore is a significant seat increment. Vellore having a significant seat increment. Uh, Mohit, I don't know about the mock result and these things because I'm not doing the professionally things. Goa 124 seats. Why not? It's a long pending demand. Regarding counseling date, Ritesh, I have replied. Dr. Jha, I think I have given reply regarding 50% seats. Uh, so your increment is in a five digit number, you know. So that's a good news for all of you. And that's 5 digit include preclinical, paraclinical, and clinical, all three branches. That all not only no, don't think that all 5 digit number for the clinical seats. Yes, Dr. Pandey, it is possible. In old medical colleges, Cuttack, yes, increasing because I see the list very briefly, but yeah, Odisha was reflecting in that one. Dr. Pandey, you will get OBG in Bihar. As I informed, PMCH already got the lion's share, but now the share is for Bhagalpur, Darbhanga, and Muzaffarpur also. In IGIMIS, also some few seats get increments. Uh, the 50% NRI sponsored candidate, as I informed, yes, they are eligible if they are on the higher merits. Definitely, why not? If it is seat is available at their rank, general seat for DNB or MDMS, then definitely they are available. Uh, this is a Dr. Ali. It's a very good question. Uh, Definitely, it's always a debatable question that okay, we should go to periphery or we should go to a central institute. You ask about the ophthalmology. So in peripheral colleges you get more hands-on experience in ophthalmology. In DNB at good institutes you will get the exposure, but you will get gradual exposure. There you have to earn the confidence of the consultant to get that exposure, but in the government institutes they will force you to get that exposure. So that's the difference. District hospitals for the DNB medicine, it's a bit dicey, because there are no faculties or permanent faculty or the good faculties are there. But yes, you will get a good exposure, you will get the good number of patients to treat, because then you will get OPD, good OPD patients, you will get a good OPD, you will get a good IPD. So if you are interested you can learn from them. But there are limitations. The a faculty who is involved in a teaching and a person who is not involved in the teaching are two different things. So who is involved in the teaching is always in touch with the new things, but those who are not involved in the teaching tend to be lagged behind. That's why they used to attend the conferences to get updated themselves. But the medical college faculties getting updates on daily basis because they have to get update, because it's in their job descriptions, they have to remain. So that's the two things you have to weigh, and then you have to take decision according to that one. uh, I think, Dr. Mr. Khan, you are asking about the NEET UG. Yes, yes, you will get UP state quota seat as well as from the All India quota seat in UP in round two. You will get it in round two, but in state quota round one as well as round two, you will get it. One more thing from this thing is I strike in my mind. When you do the counseling, I'll again reiterate at the time of the counseling also, please be sure that this time in the mop up, strict adherence to the rule. So those who joined the colleges in round 1 and 2 will not be eligible for the mop up counseling. Last year this was the bone of intention, and many things happened, and that's why the postgraduates counseling of mop-up counseling was delayed too much because of the court cases. And undergraduates counseling also in that was delayed. But this year, due to the software introduction, you will not able to participate in the mop-up counseling if you have joined the seat anywhere in the government or in private. So be careful about this one. uh, this and Balangir, and this one I think I spoke about this one, Odisha. Um, yeah, yeah, and yes, not only Odisha, Balangir, Balasore, not only Balangir, Balasore, but in all phase 1 and phase 2 medical colleges, seat increment, and old medical colleges seat increment, what is the difference? Difference is, in phase 1 phase 2 medical colleges, the clinical seats are more, and paraclinical is pathology and micropathology is in good number, pathology and micro in good number, while in old medical colleges the increment is equal, almost equal. Clinical increment is there, but slightly age, but handsome number in paraclinical and preclinical also. But in new medical colleges, very few preclinical seats, then some paraclinical seats, then many clinical seats. So this is the difference in increment in these two segments. Yes, a language is an issue for any medicinal branches. If you candidate from the South India come to North, or North India going to the South, language will be a barrier for, particularly for the North Indian to go into the South India, because that language is entirely different. Andhra Pradesh, Telangana, Telugu, Karnataka, Kannada, Kerala, Malayalam, Tamil Nadu, Tamil, Maharashtra, you get Marathi. So that's the different issue. But from the South India, a candidate can understand Hindi a bit, and they can learn Hindi quickly. So that's their call. But yes, definitely in the medicinal branches where you have to interact with the patients 24 into 7, either in the outpatient department day, or your OPD day, or in your IPDs daily, at least 3 times in a day, at least 3 times in a day, in the morning, early morning, in the afternoon, during the round of the faculty, then post round, and then late in the night. So 3 to 4 times you have to interact with the patients. So that's the issue. Linguistic barrier always be there when you go to the other states which having that language is as a not a major language in that state. More than 5,000. Don't worry, Dr. S. More than 5,000. Don't worry. This session only. What I am telling is this session only. 5-digit number, not 4-digit number. And that's why, yes, Dr. Goswami, in Rajasthan, the maximum number of seats increased in the phase 1, phase 2 in the Rajasthan, because number of colleges were more. And second criteria which applied us in Rajasthan, the number of candidates selected in the NEET UG is highest in the country. That's why they provide the number of PG seats more here to accommodate the students of the Rajasthan. But 50% seats of those seats will be go into the all India quota counseling, and 50% will come in the state quota counseling. But number of clinical seats in these colleges like Churu, Bharatpur, Bhilwara, Pali, Dungarpur, Badmer is more toward or more on the clinical side, some on the paraclinical, and very few on the preclinical side. During the counseling, when Dr. Farhan, we will check it when we fill the form, but last year it was not possible in the all India quota counseling, but in state counseling, yes, because you have to fill a form afresh. in state quota, you can change your category. That's difficult, Dr. Srivastava. Yes, Dr. Kaur, my answer is in yes. Uh, Dr. Subbu, it's touch and go, but pediatric medicine, confirm. Pattern of the NEET PG 2023 will be similar to the this year 2022 integrated questions, which I am guiding you the how the integration is going to happen, systematic integration. So particular system, all things are integrated. So nobody can differentiate this question is from anatomy, or this question is from medicine, or this question is from surgery, because everything is integrated in the question in a way that you have to apply your knowledge of each subject to give the answer of that particular question. So the conceptual questions will be more. So if you get a conceptual questions, then definitely you need to think more, and you have to apply your knowledge more. And the level of the NEET PG 2023 will be slightly higher than the next examination. That's also for sure. So next examination level will be slightly lower than the NEET PG examination, but uh, level still there will be integration in the next exams also. Why? Because in next exam, the postgraduate entrance test for the AIMS, PGI, and the JIPMAR will be through INI-CET. And another next phase of the NMC bill is to integrate few of these colleges from your NEET PG counseling top rank college to the INI-CET entrance test. In from each state, at least one college they may add to the INI-CET kitty. So INI-CET exam is different. That will takes place, and you will be eligible to give that exam only after completion of your internship, or you're just before completion of your internship. But next exam you have to appear at the completion of your final MBBS. So that's your postgraduate entrance examination immediately after the completion of your final MBBS. And next two will be conducted by the universities to pass you that okay, you have completed the training and you are now practically go into the field. Yes, 50%. Why not? For deemed private means private medical college in state counseling, and private medical college are deemed universities college through All India quota counseling. Yes, Dr. Roshan. No, don't worry. Don't worry. Yes, Dr. Sunita. Why not? In round one itself. Yes. Next will be the 2023 will be the last NEET PG. Thereafter, you have to appear for the next exams. And those students, final MBBS student who appeared in the next exam, their score in the next will be carry forward for the 3 years, can be carried forward for the 3 years. If he appear in the next year examination of the next exam, if he score less, then he can opt, okay, I don't want this score, I will use that my first score. So that system is very complex one. Dr. Padhi, mop up. Still number of seats increasing, but for this rank for MDRD need to go till mop up, because priority is medicine, surgery, pediatrics, ops, and anesthesia. Shreya in early three digit numbers in Delhi. So, expected fee for the government quota fees 2 lakh max, 2 lakh max. For the private, 30 to 35% increment. So whoever think that my budget was such, so be prepared that your budget will be increased by the 30 to 35% in deemed university and private medical colleges seats, because there also the seat increment is there. So definitely to compensate their loss. So this is all things about this one. So this is the private 50% seats for the government quota fees, same fees 25,000, but for the private quota seats the fees will be 2 lakh. And this time, because software get implemented, so no additional fees, because initial thought was that we will implement additional fees in mop-up, but now because software was implemented, and I advised for that software, so that's why I know that this is going to happen. Dr. Shah, yes, in your category, definitely yes, a big yes. Dr. Rathi, yes. I don't know, Dr. NK, about the DNB rule in the Maharashtra for the state quota counseling, because in Rajasthan and in Madhya Pradesh also, the rule for the state quota DNB seats are only in service candidate are eligible to take admission in the DNB quota seats. So I don't know whether in Maharashtra what's the rules are applicable. If there is no such bar, then definitely yes. Through state quota counseling also you can take DNB admissions if they have the seats in the medical colleges there or district hospitals. But district hospital seats mainly for the in-service candidates in the state quota counseling. Dr. Sunita, what college you want? You will get the seat, I think, definitely. Ashish, yes, respiratory medicine in this change scenario is possible for you now. Uh, Harpreet Kaur, 11.5 rank you have. Respiratory medicine is very easily available for you. In last advice is, please listen to your inner. What is your passion? In which branch you want to do postgraduates? Because I got some mails also that mm, uh, I want to do this, but my parents are forcing for this one. So please explain to your parents that this is my passion, and I can excel in my career in this branch. That's why I am opting for this one. Yes, I know everybody wants general medicine, everybody want MDRD, everybody want derma. Very few are very clear. Like I got I must, a mail, very high rank student wants a pathology, and some counselor advised, okay, Delhi is the better. But in pathology, if you want to do, then definitely the best institute would be the TMC, because that TMC is the premier institute and the most referral institute in the oncology in country. Secondly, it has a collaboration with the world's best center in oncology, MD Anderson. So that's why the pathology of the TMC is the best in the world, not in the country, but the in the world itself, because number of patient, number of referrals, all type of cases are there. And so that's why you must listen your inner. Similarly, if you listen your inner, then you will excel in your career and you will get mental peace. Radiation oncology, you can get it. When we were studying, my friends used to ask me in which branch. My reply always was that I don't give any postgraduate entrance examination for the PG. Though I gave one exam, PGI Chandigarh, but I say, okay, I won't give a postgraduate entrance examination, and I will do the specialization without giving the examination. And I did it. I did it in my specialization in the public health. So that's without examination entrance, and that too in the premier institute of the world. So number 2 rank in the world. So that's the because I was very clear. So similarly, you must be clear, okay, focused. I am going for this branch at my rank. These are the branch, and among this branch, this is my choice, and I'll go for this, and I'll excel in this branch, because getting RD or drama is not possible for everybody, you know. So that's the case, and you must adhere to that one and listen to your inner. Yeah, Dr. Nanda, chances increased, and increased to get a good seat. Akshay Sharma, what query you had? Write down again, please. What is the score of MD respiratory oncology? Radiation oncology, a branch after completion of term of job and personal setup in major city like Delhi, or also the small rural cities. This is a very good questions. Good question, Dr. Akshay. Radiation oncology is a branch which, in my view, is a neglected branch. You are doing a radiation oncology for 2 years. You have to work in department of oncology, and in 1 year exclusively you work in the radiation department. So when you work there in twin things, and you pass out after uh, successfully after MD, you are entitled. MD radiation oncology are entitled to do a practice of DM oncology. There was a huge hue and cry 2 years back in Rajasthan, which was settled down by the court and by the administration, validated by the court, the administration finding. So those who passed radiation oncology are primarily for the radiation radiation part. But if a patient come, because along with the radiation they must have knowledge about the chemotherapy also, for which tumor, what type of chemotherapy. The only portion which differentiate between DM oncology and radiation oncology is the immunotherapy. So immunotherapy role is entirely lies with the DM oncology, but the chemotherapy role lies shared by the radiation oncologist also with the DM oncology. So it's a good proposition. And secondly, if you go in a government setup, then you won't get any rural posting. You will always get urban posting or semi-urban posting. So that's the case. uh, in some cases, in government playing, and they're posting some doctors to the rural area, but immediately they are taking back their orders, and they are start posting in the district hospitals itself. So this is a very good branch, and this is a very good question, Dr. Akshay. Are you open for the Dr. Amit for the open with your purse? Then yes. But otherwise, everybody want MDRD. Yeah? So, Dr. Sagar, in last, thank you very much to give me the indication that it's over now. And to summarize the things, I have mentioned about this your seat increment. So the seat increment in two things. One is the old medical colleges. Second is the centrally sponsored medical colleges, which established after the passing of the NMC bill. Both phase 1 and phase 2 medical colleges, 57, 59 medical colleges. The list I pronounced, the in which colleges you will get the seats. State wise, I have given the list, so that you will get the that thing. Thirdly, the NMC 50% private quota seat also going to come as a government quota fee for from this year only, and seat increment in there also. So all these three club together, giving you a handsome seat increment, and uh, that will give you, or that will boost your confidence for this one. uh, the 50% rule, Kerala counseling, at the time of counseling is not started, only registration is started. So at the time of counseling, allotment will be done by the government authorities. Na? Kerala authorities, Kerala Medical College, Private Medical College Union, and fighting with the government anyway. They lost the case in High Court, Supreme Court, again from High Court. Now again they are contemplating in the Supreme Court. So they are trying very hard, but they won't get succeed. Don't worry, Dr. Khan. As far as Dr. Logu, going with the statement of your state health minister, yes, FRC work started in Tamil Nadu, because I got a statement from your health minister. Health minister said that we are going to regulate the fees in the private medical college through fees regulatory committee from this session. So your health minister is committed for this one, and your chief minister is very sensitive on this issue. So definitely, I think you are going to have this one. Hostel fees is different. Hostel fees is, but hostel fees has to be, not to be in too much. So they will not charge more for the hostel, not more than 3 or 3.5 per annum, not more than that. So that's a good proposition. So GM possible for Dr. Das in Kolkata medical colleges. Don't worry, Dr. Das. Yes, Momita Das. FRC work. mm, because government of India is pushing very hard. They have sent to reminder to all the states, and they are asking the update from that one. So this is all from my side. Have a nice Sunday. Enjoy your day. Get relaxed. And those who are worried that we are going to new medical college and what will happen, a sincere advice to them is join some private practitioner site for 1 or 2 months, 1 month or 2 months, 1.5 months, whatever time you get, and do a noble job over there, just to learn. Money is not important, just to learn. That's why I say noble job, so that you won't face any problem. And those who will going to the new medical colleges will get hands on from day one itself. So that's a big advantage for all of you, for them. Thank you very much, and bye.